Hello, everyone. Welcome to our panel today. We will be discussing the effective project delivery process. Our topic is solving the puzzle, ensuring an effective project delivery process. And we've prepared a very informative and lively discussion for you. We're very excited to be here today. If you have questions as we go through our discussion today, please add those to the chat in your window, and we'll be sure to try and include that in our discussion. We love having feedback. We'll start with some introductions and then we'll get into it. So I'm Jillian Schloss. I will be your moderator today. I'm an assistant vice president with Plenary Americas, a private infrastructure developer. I oversee construction and facility operations for a national portfolio of projects valued at over $2 billion. I spent over 10 years of my career in alternative project delivery. Very big proponent of the model, and I specialize in design, build, finance, maintain type models. Prior to joining Plenary, I worked as a general contractor doing solely hospital projects, including a behemoth 1.7 million square foot hospital, Canada's first fully digital hospital. Aside from my professional experience, I'm a civil engineer by trade, and I also have a master's in construction economics where I did a dissertation on public capital investment in alternative infrastructure delivery. So I'm very excited about this panel, and I'd like to introduce our panelists. Why don't we start with you, Patrick?
Sure, Jillian. Thank you so much. It's great to be here today. Any chance we get as in the industry to collaborate is one that I'm always excited about. I represent CBRE Healthcare, work with them across North America, leading what's called our Healthcare Project Advisory Solutions team. Been engaged and involved in the healthcare side of the business since 1996 and have seen it grow and mature both from a healthcare business and also the design and construction side of that business. So I've been engaged and involved on a lot of integrated project delivery projects and other models that hope to increase collaboration and get better outcomes as we all work to get a net gain in our efficiencies working together. So thank you.
Jonathan, can you introduce yourself?
Absolutely. Thanks, Jillian. And I'm also very excited to be here. I'm really looking forward to a great conversation. My name is Jonathan Coxwell. I'm the Assistant Vice President for Facility Services and Engineering for the Western region of Northwell Health here in New York State. I hold responsibility for all of our facilities development as well as ongoing operations, maintenance, et cetera. I've been working in the healthcare field now for a little over 25 years, and I'm really looking forward to this conversation. Thanks.
Thank you. And lastly, Denton, can you introduce yourself?
Thank you, Jillian. Absolutely. Honored to be here. I love these conversations and the opportunity to just discuss very robustly our mission in life. Love working on the healthcare sector. I'm Denton Wilson, Vice President of Atrium Health, Planning, Design, and Construction. We are a sizable healthcare system that has a huge desire to really reach out, innovate, really serve the community at all levels. I'm pushing 30 years as well on the owner side. I'm incredibly passionate about the aspect of delivery and how to raise the bar and get the best value, create the best environment. So all the folks that we hire have the best opportunity to really raise the bar and be proud of their journeys. Thank you for having us.
Thank you for joining. So to start off with, I'd like to get a perspective from each of you, from your experience in the healthcare field. What does collaborative project delivery mean to each of you? Maybe let's start with Patrick.
Sorry about that. Making sure I was not on mute, since we have that as one of our goals as a team. It can mean a lot of things to a lot of people. To me, it's very simply put, taking and harnessing the talent of the people that are engaged and involved on a typical project and doing that very early on so that you create a situation where you understand what the risks are, how to mitigate those risks, and you have a plan of attack rather than being so reactive, you're proactive. And the only way to do that is to use the experts around you and bring them in at the proper time. And you have to lead and facilitate the right conversations in that kind of model, as we'll talk about. But if you do that and you leverage the technologies available to us today, you can be highly collaborative and highly successful on any project that you undertake and outcomes that you desire.
Excellent. And Jonathan, what does it mean to you?
So when I think about this and try to narrow it down to a sentence, I think I really look at, the importance of building a solid and trusted team, and making sure that team has a singular goal to create, a quality product at a reasonable cost in a reasonable time frame through collaborating an early conversation about the best method to get from the beginning to the end, and to trust the experts, as Patrick said, trust the experts that you have pulled together to be able to show you what that path is, and to say, let's all work together to get to that end game. But it's, to me, the key of it is for a successful collaborative project is trust within the team, and trust that you all are there with the same end goal in mind.
Yeah, it sounds like a common theme, trust and leveraging the experience on the team throughout the delivery process. Denton, what does collaboration and collaborative project delivery mean to you?
Well, it's an overused buzzword, right? So it's I love the term willing to collaborate. That willingness is what we're looking for, and for us to create a holistic environment that, through a procurement process, engages the right talent at the right time. It's really four fundamentals. It's collaboration, is team chemistry, team engagement, team alignment, and timely decisions. You have those four fundamentals, you can establish an environment of collaboration. And actually, mine comes down to a little bit of a formula. Collaboration equals accountability, and accountability equals measures of accountability. Show me your measures, because collaboration is about accountability.
I think that everybody's looking to get that kind of accountability as you go through these complex delivery processes, big construction projects. It sounds like a really great thing. As you say, it's a buzzword, but it's actually something that's very important. That said, I think it comes with a lot of challenges. It's been difficult to implement in many projects. So, Jonathan, what are some of the challenges that you've seen or experienced in trying to foster a more collaborative project delivery process?
I think one of the biggest challenges that we run into is being in New York State, and being in a very old school traditional construction kind of environment. It's been slow to adopt different delivery methods from your old traditional design bid build world, and I think what happens, or I think what has happened so far, is that people look at a collaborative type project and they immediately pigeonhole themselves into the whole concept of IPD. And then everyone starts getting into that never-ending debate about contracts. And we can't agree on how the contract's going to work for an IPD, so it'll never work. And I think, one of the challenges that we have is stepping outside of that box and saying, listen, before we talk about contracts, let's talk about how we collaborate. And let's go to the contracting after we figure out exactly how we want to deliver this project. I think you can bring the lawyers in later and say, here's what we want to do. Now make it in 1,000 words or less. Good luck with that. But I think when I have a lot of partners that I collaborate with here very successfully, and I think when we have kind of a double-edged challenge, I think, sometimes, where we have the challenge outside of our organizations and trying to get everyone to think outside the box. But I think we also have the challenges within our organization. And everyone has been so used to the delivery methods and the way that we procure construction and the way we procure architecture and engineering. And there's a comfort level that we're doing it right. We're following the steps. And we also need to get that same kind of buy-in from our senior leadership within our organization for them to be able to say, all right, you're right, go for it and do it the way you want to do it and show us why. And I think one of the silver linings, one of the very few silver linings that we may find from this last year's battle of this pandemic is we all have had to operate this way. We didn't have time. We didn't have the ability to follow any kind of project thing, but get the team together, look at the problem, find a solution and solve it and move on to the next problem. And we've shown that it's absolutely doable. It's doable in a cost-effective way, and its speed to market is remarkable. And so it's incumbent upon us to now build upon that within our organizations to say, look what we did last year. Now let us do it when we don't necessarily have the pressures that we had last year. Let us show you why this works in the normal conducting of business.
Yeah, I like what you say, saying stepping outside of the box and thinking about how you want to approach a project before you even get the lawyers involved, before you have a contract. You know, how do you want to see this project succeed? And so, Patrick, to elaborate on that and stepping back from the contract, why should owners focus on desired outcomes and looking at the project differently right at the outset when they're starting to plan a project?
Because then that gets to, and I know Denton will talk about this, I'll give a lot of it to him, but you know, he spoke about being able to be measured, being able to be accountable. And if you don't have clear outcomes, you can't measure if you're successful or not. I think some people by design want it to be where it's not as measured because then they can choose whether they're successful at the end or not with a project. But really and truly, when you're talking about this, I think what I try to get our healthcare clients to do is look at this as they're looking at the population they serve. They have outcomes that they have to deliver for a healthy population. And now the way that the models are changing for how they're going to be reimbursed in the future, those outcomes are going to mean everything, right? And so they've got to do their business different when it comes to patient care, and it's no different than project delivery as well. And so it's extremely important to understand what you're trying to achieve project to project, how that ties to your overall business imperatives, objectives, your mission as a community organization, and then be able to take that and to be able to measure those along the way to see, are we going on the train of success or are we not? And of course, that drives procurement, as Denton says, and he talks about so well, and then it drives the processes, the behaviors you're going to use, and ultimately you need some contract to support that. We have to, unfortunately, we live in a world where there are contracts. And so that's the way it needs to happen if you're going to have ultimate success. Are you going to have success if you don't do that well? Here and there. But again, this is not about just having success. This is about having the optimal outcome every time you engage on a project.
Great. And I'm going to hand it over to you, Denton, to expand a little bit on that, you know, from an owner's perspective and owners really driving the collaborative process and trying to move towards that. What are some things that owners can do to achieve those desired outcomes to make sure that there's accountability throughout the entire project?
Yeah, I appreciate very much what everybody's saying, but it's such a fantastic opportunity that we have to have the courage to engage. It's an opportunity where we have to change our procurement process by defining what we want out of that procurement process before we do it. So as an owner, if we really want to engage in true design assist versus design told, if we really want to get into the depth of what we can get out of technology and BIM, if we really want to dive deeply into prefabrication, and you start backing in what does it take to achieve those elements, then you actually change the way and the questions you ask in your procurement process. If we go out as owners, and we do, we're very proud of what it takes to, and it's extremely harder than most people believe to be an owner through the procurement process. It's taxing, it's stressful. You have to read the tea leaves a lot of times. And so we as owners are starting to find that our guidance by plan instead of reactive but proactive to our expectations gives our teams a much better foundation of a starting point. And what I mean by that is if you really want prefabrication in today's world, and the labor market is short, especially here in Charlotte, we must have prefabrication, which means we must have a design team that understands and values prefab, which means we need the contractor and especially the trade partners on the table at the same time to help guide the pencils. Then what questions should we ask when we're procuring our teams? And so we've driven that to an aspect of, let's just be honest, I had a beautiful opportunity back in Dallas to take the Methodist Health System and transition them from a fairly transitional environment to a really collaborative, very passionate, integrated place. And I'm doing exactly the same thing in Charlotte. And it is the gift for me, like no tomorrow, to have the opportunity. It is incredibly hard because commonly we hire the best people in the business and then we ask them to do something different than what they're used to doing. And the people hardest to change are the ones that are already best at what they do. So the best thing we can do as owners is to write down and be very prescriptive and very clear of what our expectations are. And so when I went to Methodist, when it came to Atrium, the first thing I did was write a 4-page document called The Approach, which is a document that describes the expectation of the type of environment that we must have to be successful. Roles, responsibilities, what lean tools we're going to use, what lean mindset we're going to have. Tools are one thing, mindset's another thing. What culture and behavioral we're going to do. When are we going to do retrospectives? That all needs to be really presented at the front end so you can really measure a team and their ability to achieve that. Instead of asking teams from an owner's perspective, now, what projects did you work on? It's really about what project did you work on and what was your role? And did you really engage in design assist? Did you really engage in target value design? Did you really have a lean mindset with using A3s and CVAs to make decisions? If that's it, then all of a sudden you instantly start the foundation and the environment of collaboration based on having the right team from day one to engage. Most of the folks in the industry know that I've pulled off a couple of times something that I love, which was called not an RFP, but an RFC, which is a request for collaboration, which is the aspect of an owner being so engaged and so focused on supporting the needs of the team so the teams can surpass their own expectations. That's the owner's job, is to create the environment. We're not here to build the buildings or design the buildings. That's the folks we're hiring. And so the RFC was a basis of getting down to the final 2 folks and watching them work holistically for 3 weeks on 3 to 5 CBAs so we could see how they really engaged and what level of collaborative leadership they have. We've gone from hiring just technically people to smart people, smart people. And I think that is the key element when, as owners look for teams in the future, we're looking for people that are people smart.
Yeah, there's a lot to unpack there. It sounds like approaching procurements differently from the start, from every aspect of it. I love the concept of an RFC and really the owners driving the process and everybody buying into that. When we speak to the challenges of actually running a procurement process, I mean, Denton, you said right out front, it's challenging, it can be taxing, and to challenge the status quo can be quite difficult. So I wanted to ask, Jonathan, from your perspective, when you're thinking about all of those things, how is the owner's project management approach different when you're prioritizing collaboration from the outset?
I mean, I'm just going to branch off some of the stuff that Denton was talking about. I think, really the first step is to get out of the way. you build a collaborative team of these remarkably intelligent people that, and once you've gotten through, and I love that, Denton, the RFC, once you've gotten through that process and you've built this team, the project management then almost shifts to not as much project management of your design, construction, integrated collaborative team. Your project management is managing your in-house people, because what's going to get in the way of this project? What's going to get in the way is information. And if the information isn't flowing fast enough to this team that is working so solidly together, then the owner ends up standing in the way of that team succeeding. And ultimately we hold the responsibility within our organization to successfully deliver this project. But I similar to Denton, have always said my job is to remove obstacles. My job is not to get anything accomplished. My job is to get everything out of the way so the really smart people can get stuff accomplished. And that to me is where it almost allows the project management from the owner's side to more effectively do the things that they need to do internal to the organization to, again, get the things out of the way so that the project team can achieve what they need to achieve in the time frame that they've been challenged with.
Speaking from the private sector perspective, to hear an owner say, we remove obstacles, we're not there to get in the way, I think that approach leads to the opening of doors of opportunity on innovation. Like you're saying, if we're going in with that mindset, everybody is really working towards the same goals. Everybody wants to see the project done. We don't want to get into disputes. We want to achieve it on time, have a happy client, seeing the community served. So I really appreciate that perspective. And I want to shift for a second, because we've talked a lot about the owner's perspective and the onus on the owner to set the tone for achieving collaboration and approaching projects in this different way. And so maybe, Denton, can I ask you, how would you actually incentivize the private sector to collaborate? And how do you work within the confines of the contract to incentivize that behavior?
Yeah, it's a great question. It really is, because we have to define first off, what is the word? What does incentive mean? There's a financial aspect that everybody leans directly on when you say incentive. What is the dollar value? I've done IPD contracts with full-blown, incredibly long Excel spreadsheets of how to separate an incentive based on a percentage of fee put in place based on the size of the contract, so everybody gets a fair incentive at the end. And I think there's some real strength behind that, depending on the strength of the owner's engagement. I find IPD as a contractual tool to be really good for folks that don't do a huge volume of work that needs structure to put in place to create what I would typically call the mayonnaise and the mustard to keep it between the lines, right? I also believe that you can do incentives outside of IPD contracts on shared savings. And I'd also go as far as to say, of the project teams that I've been blessed to work on, over $3 billion of work completed and up to $3 million in process right now, we have a big band of opportunity of measure. And I take a lot of pride in this next statement. I would tell you that I can give you a laundry list of folks that have worked on projects that my teams have put together that would put aside a dollar monetary incentive all day long just to be able to work in the environment that we create. And so it's a whole different statement of what incentive is. And I would ask the audience, if you asked yourself the question, which was, if you had an opportunity where dollars weren't the driving factor of it, and you could work for whoever you work for, and you list out what those parameters are, a fair owner, a good culture, growing your people, all the things that really drive our hearts and our souls, I don't think dollars would be high on that list. Now, I'm not saying dollars aren't important. I can just say that on a really collaborative project that really engages in the lean process and prefab, then inherently those projects are going to make more fee at list risk to start with.
And I'd be curious, Patrick, if I can put you on the spot for a second from your perspective of working with owners and responding to, RFPs or RFCs, and you see the standard approach versus alternative approaches. What have you seen in terms of incentive, and how do you approach that when you're responding?
Well, I think, again, Denton's right. There's the incentive. We work together. It's kind of a niche environment, especially those practitioners in the healthcare world. And so for us to have a platform which we can share in a way as far as collaboration that we could not otherwise, it's going to be a much more welcome engagement for us than the alternative. So that's one. I think the incentive piece on the project side, I think it needs to be about not just the status quo, but driving those defined outcomes and those measures at the end. I think one place that IPD falls very short, and we'll get into this later, is the owner's real risk as an asset-heavy industry is on the back end of these projects, managing those assets, managing the facilities, repurposing those assets later, renewing them, et cetera. That's where all their risk is. And that being said, IPD does not go far enough in a risk-sharing model where those private sector entities, as you were calling them, Jillian, are actually aligned with the owner in that back-end risk. And so while it gets there and some of the incentives we can put on life cycle, et cetera, can help, it just doesn't go far enough, in my opinion, to healthcare owners' true risk when it comes to facilities. And that is the back end of operations in the life cycle management.
Yeah, and that's something that I actually work in, trying to evaluate the total cost of a project, not just the construction, but actually operating it and maintaining it. And what does the capital refurbishment look like? What is the life of the facility that you're trying to build? Is it a 50-year building? Is it a 100-year building? All of those considerations can be part of your project up front. And you can be making decisions where there might be a little bit more capital cost, but it means less refurbishment cost down the line. So I want to dig into that a little bit, Patrick, because you've stepped on something really interesting here. So looking into the future, when you're saying maybe it doesn't go far enough, what kind of opportunities are there for alternative approaches in healthcare projects? What does that look like?
Well, I think it's healthcare portfolio management when it comes to the assets that they have. I think that's the way to put it. The bottom line is this. While healthcare organizations have done a good job of cutting cost, the problem is they haven't cut cost as fast as their reimbursement's been cut. So they're still looking down a dark hole of where reimbursement doesn't keep up. It just doesn't pay for everything. And when you're as heavy of, think about how many assets a healthcare client has, from the equipment to the building, and then those assets have regulations on them. The environment of care, infection control, et cetera. It's not just like running a restaurant down the street or an office building. So it's an enormous cost pressure, enormous management pressure. And so I look at that, and then I look at the industry as a whole moving to more of an ambulatory retail medicine consumerism type model. And healthcare clients are facing headwinds from people in that business like Walmart, CVS, et cetera. And you have to start to decide, are you going to try to do all this on your own? Are you going to create collaborative partnerships where you, and again, it's not just you give away and give up control. That is the fundamental problem with this. People think they're giving up control. No, you engage someone, you tell them the outcomes you desire, you share the risk with them, you shed more risk to them, and you manage these relationships. You can't have a relationship, whether it be on a project or long-term with a radiology provider that's part of your organization or anesthesia group, et cetera. You have to manage those relationships and be clear about the outcomes you want out of them. And so I think you're going to see more managed equipment service models, that extend not just for medical technology, but also infrastructure. I believe you're going to see more of the PPP model that, Jillian, you have a lot of expertise with in Canada, et cetera. I think that level of partnership and collaboration is going to have to happen if healthcare clients are going to stay afloat in the future. Again, with what they're staring at as far as the reimbursement trends, the expense trends, and just their obligation as a very, very heavy asset weighted industry.
Thank you. There's a lot to think about there and lots of opportunities. I wanted to see if Denton or Jonathan, you wanted to add anything onto what you see in the future.
I think a lot of what Patrick was talking about is very intriguing, especially when you talk about the, kind of shared risk when it comes to infrastructure, et cetera. I know that's something, Jillian, that you have a lot of experience with, and something that I don't think we have that much experience with in the healthcare world down here. And I think, when we look at where healthcare is going, and you're talking about a business sector that on average probably operates on a 1 to, if you're lucky, maybe 3% margin, and you got a lot to accomplish in that. And you compare us to the retails, the Walmarts, et cetera, who are operating with these ginormous margins, and they can say, yeah, let's give that a try, throw $1 billion at it, and oh well, it failed. We don't have that opportunity, and and I think that's also where this collaboration kind of can help us push the boundaries even further and be able to say, because a lot of these people do work in multiple different fields and can bring to us what they've learned, working for an Apple or working for Google or something, and bring thoughts and ideas that maybe are being discussed elsewhere to us and say, well, what if we did this? And I'm also finding, the ability to utilize their resources to start building partnerships and to start as we look to push innovation. I mean, healthcare innovation moves quickly in the medical side of it. We in the facilities side always, kind of get the short end of the stick a little bit because, they want the money gets focused on, the latest, greatest MR, CT, we need new operating room for this. We need, and the money goes there. And do you really need that super fancy PMS? Can't you just, and even though you sit down and show them what it does and what it means to your bottom line, it still is almost secondary. And if we can look into these concepts of shared risk and shared risk and shared gain, it's a very interesting conversation to be had as we work our way down the road, I think.
Jillian, let's take it down to another sidebar on it. So the aspect of if we're really going to change the procurement process and really engage our teams differently, and we understand that some of the numbers that we're still seeing says that there's 57% waste in our processes, and we're still building prototypes, one-offs, then we really need to engage differently, and we have that responsibility to engage differently. And that means that we need to reduce waste, start standardizing in best practice, defining what best practice is. At Atrium, we took a moment because of the volume of work we have to standardize our patient room and our operational delivery on patient floors. And all of a sudden, we have the ability to prefab 700 patient rooms. I have a project that's coming out of the ground right now that's hitting over 50% of offsite prefabrication for that project, and that team wants more because all of a sudden they've started seeing the real value of prefabrication. When you start doing mechanical racks and you see that it's saving us 38% on the labor force, that's real dollars. That's real reduction of the money that is costing to build these facilities to what Patrick is saying, and we're doing our due now, which we have to do. And when we actually start seeing teams really think outside the box and start measuring the elements that we can get from the change in procurement for the betterment of the process, We change the delivery of how a project's put together because of prefabrication. We reduce the amount of time, which means we can actually start revenue faster. Those are, when you stop measuring the cost of a building from day one to the day it opens, measure it versus the typical project schedule, and say if we are able to achieve certain elements of exterior skin. I have a project that the entire masonry exterior skin is prefabricated in Atlanta, been shipped up here, and there's no scaffolding on project. You want to watch a whole bunch of people smile based on the efficiency of a project and how much sooner we can put that in place and how much we can go to my CFO and talk about how much more revenue we can create. That's not about the cost of the project. That's talking about the impact of the bottom line of the healthcare system, which is now serving the community better and faster at a cheaper cost. We have to back away of why we're doing a change in procurement. I did not come to Atrium to force prefabrication. I love prefabrication because it gets our teams to think differently about how they can work better with each other. But honestly, I did it because of that fourth factor of those fundamentals. I use prefabrication because I want faster decisions, and it was an excuse. And you ought to see what that does to a project team.
No, I mean, and that comes right down to the outcomes. You focused on what those outcomes are, and you're finding innovative ways to achieve those. We're almost out of time here, but I do want to give each of you one last opportunity to speak to our audience members. And there's been a lot of takeaways from this discussion about the importance of viewing procurements differently, the role of the owner, how you can think about contracts differently, and even the procurements themselves. If you had to give one takeaway to get started down this path to those listening, what would that be? Denton, why don't you start?
Yeah, so start thinking about collaboration, not as collaboration. Think about it as the structure of collaboration. What is the plan? And when I say structure of collaboration, it's from the moment that you decide you have a project. When do you need the team? Who needs to be on a team? What are their commitments and goals that they're going to achieve? And then define what that structure is. Define what it's going to take to do an alignment session. When you put the team together, architecture, contractor, and major trade partners, do yourself a favor. Have a real formal alignment session and talk about roles, responsibilities, what technology you're going to use, what authority matrix, who can make decisions, what's the organizational structure of that project team. Are you going to have a steering team? You're going to have core teams? You're going to have cluster groups? Formalize that. Make commitments. So when you stop and say, how are things going on a collaborative team, which you should at least 4 times, which are called retrospectives, at the time from drawings, transition from drawings to construction, topping out, drying in, and 90 days before the end. And you can ask the question, how are we doing? Now you have something to measure it against. If you don't take a moment at the beginning of the project to define your measures, then you can't measure to see how you're doing. And by the way, the secret to that is when you put all your peers in a room and ask how everything's going, they're not going to tell you anyhow, right? They're not willing to speak in front of their peers. So find that people smart aspect of it. We put those measures on the wall. We ask them not to say a word, and they take green, yellow, and red dots and put green dots on things that are going well, yellow on things that aren't we need to focus on, and reds on the things that aren't going bad, and they will dot the tar out of that wall. And now you know what to do to make Monday a better day.
I haven't heard of that approach, but I really like it. Jonathan, if you're going to give one takeaway to the audience of how to get started down the path of alternative approaches to project delivery and collaboration, what would you say?
I think the thing for me that drives the whole success of a collaborative environment is being able to accept trust, is to be able to accept the trust of really what you're building as a family. Is you are creating a family outside of everyone's family that is going to live together for a long time, is going to work together for a long time, and I'm in complete agreement with everything that Denton's saying, but kind of taking it to a different angle of being prepared up front to accept that this is going to be your family. and that everyone understands that, and that everyone is on board and wants to be there and wants to succeed and achieve. And I think once you can get through that and then sit down and have that initial conversation with this new family, you're off and running in the right direction.
Yeah, removing that us versus them mentality, and really we're all in the boat together, and we're gonna sink or we're gonna succeed.
Absolutely.
And Patrick, from your perspective, one last takeaway for our audience members.
Yeah, I would just say well-meaning people are like lightning in a bottle on these projects. So, you get good people, but you really have to, it's incumbent upon you to put them in a position to be the best of themselves. They want to be accountable. They want to do better work than they did on the last project. I promise you that's the way a majority of people are. So you need to start with outcomes. You need to clearly define those. You need to procure in a way that gets people aligned around those outcomes. And then you need to drive the solution working with them. And that can be a multitude of ways, but that breaks it down very simply. And if you operate on that premise, I think you're going to be much more successful despite what kind of contract you end up with. I think that will put you in a net gain situation from where you are now to where you want to go.
Well, thank you, Denton, Patrick, and Jonathan, for all of your perspectives and expertise that you bring to this topic. It's been very enlightening for me. I hope it has been for our audience members as well. So just a huge thank you. And if you'd like to share your information for the audience members to reach out to you, feel free to do so. And thank you.